name is Angela Fellers-Lemire, and I am the nurse consultant for the Women's Wellness Connection program. Today I will be reviewing aspects of cervical cancer within the program. I'll start by reviewing cervical cancer screening guidelines in WWC and then move on to the diagnostic guidelines. Adherence to medical policies and guidelines is essential to reimbursement for individual clients. Reimbursement cannot be made in cases where WWC guidelines have not been followed. Policies and guidelines are evidence-based and compliant with the Centers for Disease Control and Prevention, or CDC, rules for funding. Basic screening services must be provided on-site as an office visit. Clinical services other than basic screening services may be carried out by a WWC agency or through subcontracts with other agencies, for example, colposcopy or LEEP procedures. Each agency is responsible for the care and follow-up of its clients enrolled into WWC. In other words, each agency must navigate and case manage the clients it enrolls. Cervical cancer screening guidelines include a required annual cervical health history and education. Cervical health history must be documented in the client's chart and must include if the patient has had a history of cervical intraepithelial neoplasia, CIN 2, 3, or CIS, or cervical cancer. The history must also include the patient's HIV status, if the patient was exposed to DES in utero, and if they have a history of conditions resulting in a compromised immune system. This includes, but is not limited to, organ transplants, chemotherapy, and chronic corticosteroid use. Hysterectomy status must also be obtained and documented. Cervical health education may be provided by the provider or other trained staff in verbal or written form. This education must be provided to receive C1 level reimbursement of the BPS. Annual pelvic exams are covered by WWC. Yearly pelvics are considered optional and based on provider and client's determination of need. Performance of a pelvic is not required to receive reimbursement at the C1 level of the BPS. Cervical cancer screening intervals have dramatically changed in the past 5 to 10 years. Providers in the United States are recommending women not undergo a PAP every 1 to 2 years, but have lengthened the amount of time in between PAP smears for average risk women. WWC reimburses for PAP test alone every 3 years if the client has no history of an abnormal and test result is negative. If co-testing is performed, HPV along with the PAP smear, then her next PAP would be in 5 years. There are plenty of exceptions to the routine screening guidelines. These exceptions are located in the toolkit and can also be found on the American Society for Colposcopy and Cervical Pathology, or ASCCP, website. If you have specific questions regarding these exceptions, please email or call the WWC nurse consultant. Cervical health education must include information about cervical cancer screening interval options, risk factors for developing cervical cancer, symptoms of cervical cancer, and information about how to prevent cervical cancer. The cervical cancer fact sheet can be utilized for this education. Providers should utilize the 2012 American Society for Colposcopy and Cervical Pathology guidelines for the management of any abnormal cervical findings. Approved cervical diagnostic procedures include HPV testing as a screening or a diagnostic tool, diagnostic excisional procedures such as LEEP or cone biopsies, GYN consultations, cervical polyp removals, colposcopies, and endometrial biopsies for workup of atypical glandular cells only. Cervical procedures that are not reimbursed in WWC include PAP and/or HPV testing obtained earlier than the recommended intervals, an endometrial biopsy for reasons other than follow-up of atypical glandular cell PAP test results, and clients who have had a hysterectomy with complete removal of the cervix for benign reasons and who have no history of CIN2 or worse are not eligible for WWC screening services. If you have any questions, please be sure to contact the nurse consultant or your program coordinator.